Fog sits low on a Louisville hillside. The windows are empty now, but the architecture still points outward, built for light, built for air, built for the idea that breath could be restored. Brick arches hold the damp. Porch rails trace long curves where beds once lined up like quiet ships at dock. Somewhere below, a tunnel runs down the slope, practical in its origins, famous for reasons it never confirmed. Waverly Hills is remembered in two languages. One is medical, tuberculosis, isolation, rest cures, and the long waiting that turned days into years. The other is modern, tours, late-night flashlights, and a building marketed as a haunted hospital. But the hill does not need exaggeration. It already lived through a century of fear, hope, and neglect. So the question is quiet and sharp. Is this a curse we can feel, or a consequence we can finally name? Chapter 1. A City Looking for Air. In 1906, Louisville is not looking for spectacle, it is looking for relief. Tuberculosis does not arrive like a storm, it settles in. It takes rooms, it takes families, it takes time. In the early 1900s, across America, the disease is so common it earns a nickname people whisper with dread, the White Plague. And Louisville is a city that has reasons to worry. It is industrial, it is growing, it is a river city, busy with trade and smoke and crowded housing. Public health reform is still uneven. Antibiotics are not here yet. Even the best doctors are limited to what they can see, what they can drain, what they can recommend. Fresh air, rest, nutrition, separation from others. So civic leaders and health officials start building an idea more than a building. A board is established to address tuberculosis care and containment. The logic is simple and it is harsh. If the city cannot cure the disease, it can at least slow it down. It can isolate it. It can move it. This is the beginning of the hilltop story, not a ghost story, a public health story, a story about how a place can be created out of fear and still be motivated by compassion. This is the sound you will hear again and again at Waverly Hills. Air moving through empty space, doing what it has always done, whether anyone is there to benefit from it or not. Chapter 2. The Hill Chosen. When people talk about Waverly Hills today, they talk about the building, but the story begins with land, a ridge outside the city, a place that feels removed, a place that can be controlled. The hill already has a name, and like many names, it begins with something small, a schoolhouse, a teacher with favorite books, a quiet decision to label a place with a word that sounds peaceful, Waverly. And in 1908, that name is carried forward into a new purpose. The hill is chosen because it is distant from the city, because it is elevated enough to promise better airflow, because it is scenic enough to feel restorative. In that era, there is real belief that environment matters, not as a myth, but as medicine's best available tool. So they break ground, and the first version of Waverly Hills is not a massive Gothic landmark. It is a simpler wooden complex, an administrative building, open-air pavilions, space designed around the idea of the cure that was most fashionable and sometimes most effective in a world before modern drugs. The open-air treatment. Light on the skin, cold air in the lungs, rest that borders on surrender. It is hard to communicate now how reasonable this felt to people then. If you could not kill the bacteria directly, you could at least give the body a fighting chance. And if you could not offer certainty, you could offer a hill, a view, a routine, a place that said, quietly, we are doing something. In the early photographs, Waverly looks almost gentle. That is the first trick of the hill. It can look gentle and still hold suffering. Chapter 3. First Buildings, First Patients. Construction begins, and soon the hill is learning a new rhythm. It is not the rhythm of visitors. It is the rhythm of patients. Footsteps of staff before dawn, the soft scrape of bed frames, the repeated sound of coughing, not dramatic, not cinematic, just persistent. It becomes part of the background, like wind through trees. The first facility opens in the early years of the 1910s, and almost immediately it is not enough. Because tuberculosis is not polite. It does not wait for hospitals to be ready. So Waverly grows in stages. More space, more beds, more pavilions, more need. And behind every expansion is a quiet truth. A sanatorium is not only a place you go to heal, it is also a place you go to be removed, to be separated from the life you were living, so the people you love might be safer. That separation has a cost. You can feel it in the design, the porches that face outward as if the building is always looking away from the city. The way the structure is positioned to catch air, but also to keep distance. For some patients, Waverly is hope. For others, it is a last address. And for most, it is time. Time measured in daily checks, in meals you may not taste, in temperature changes that matter because the air is part of the prescription. This is also where the myth layer begins to form, even if nobody calls it myth yet. When a place becomes known primarily for one kind of human experience, it starts to attract stories the way it attracts fog. Some stories are accurate, some are exaggerated, some are invented to fill the gaps that official records leave behind. But in these early years, the hill is still more practical than legendary. It is a working facility, a place built for healing, a place built because a city is afraid and also because a city cares. Later, when people say Waverly Hills was built for death, the record argues back. It was built for breath. Chapter 4. The Big Expansion. By the 1920s, the wooden beginnings cannot keep up. There are repairs, limitations, a constant pressure to accommodate more people. And in public health, pressure has a way of turning into concrete. So the decision is made to rebuild at scale. In 1924, construction begins on a new main building, larger and more durable, designed to be a modern institution rather than a hillside experiment. This is the Waverly people recognize today. The long, curving wings, the imposing presence, the sense that the structure is not only a hospital, but a system. And in October 1926, the new hospital is dedicated. It is built to hold hundreds of patients, with reported capacity often described in the range of roughly 400, and sometimes higher in accounts that talk about crowded periods. Think about what that means. Hundreds of people, many of them young or middle-aged, living in a place where the central activity is waiting to see whether the body will recover or surrender. Hundreds of individual lives folded into one building. And the building itself is placed on a nominated site of about 16 acres, enough land to feel like a world apart, especially when the fog comes in and the city disappears below. This is where the hill changes character. The early Waverly is a set of structures. The 1926 Waverly is a landmark. A hospital built like a promise, and like many promises, it carries a shadow. What happens when the promise cannot be kept? Chapter 5. A hospital built like a machine. If we want to understand Waverly Hills, we have to stop thinking of it as a spooky shell and start thinking of it as a device. Not a machine with gears you can see, but a machine with airflow, sunlight, and routine. Up here on the wooded ridge, the main building is not small. In the historic description, it's a large 4-story brick and stone structure with a curved plan and a square tower rising above the entrance. Even the entry is deliberate. A 3-bay Gothic arched porch that feels almost ceremonial, as if the building is trying to dignify what happens inside. But the real design choice is quieter than the tower. It's the way the building turns outward. Sanatorium medicine in the early 1900s treated tuberculosis with what it could control: exposure, rest, nutrition, and separation. The hospital's architecture had to cooperate. It had to pull patients toward light and move stale air away. It had to keep people apart, but not completely alone. And it had to do this every day, in every season, for years. So the structure becomes a set of repeating decisions. Long corridors that let staff move with purpose. Rooms arranged to keep doors opening to the outside. Broad edges where air can reach bodies without being invited. A curved plan that doesn't just look dramatic from a distance, it changes how wind and daylight touch the building. And inside that design is a kind of moral tension. A tuberculosis hospital is built to protect the public, yes, but it is also built to contain the sick. Isolation is part medicine, part policy. The building becomes a promise to the city below. We're taking this seriously. We're putting it out of sight, up on the hill, where air is cleaner and distance feels like safety. Because the same design that feels hopeful in daylight can feel like exile at night. For a patient, the building is not just shelter, it's a calendar. It tells you when to wake, when to rest, when to sit still on a porch, when to eat, when to be checked, when to wait again.
And for staff, it's a system that has to keep moving even when outcomes do not. That's one reason this place gets under people's skin today. Waverly Hills was never a random ruin. It was built with intent, and that intent was breath.
Chapter 6. Life on the Porches. The first thing many people imagine is dramatic suffering, but what most patients would have remembered is repetition, a schedule that doesn't care how you feel, a rhythm that treats your body like it's on loan from the future. Sanatorium life was built around the belief that rest and fresh air could do what early medicine often could not, and Waverly Hills was shaped to enforce that belief day after day until it became normal. There's a photograph in the University of Louisville's collection that shows the reality without needing any haunted storytelling at all. A row of women in beds sits on a porch, the women's ward. The beds have wheels. The doorway behind them is open. Each patient has a small table beside her bed for glasses, flowers, books, and whatever small items make waiting feel human. That image matters because it tells us what treatment looked like most of the time. Not a dramatic procedure, a bed rolled outward, a body kept still, air forced into the center of the day. You can picture the sensory details without exaggerating them. The sound of sheets shifting as nurses adjust blankets, the hush of a hallway behind the open doors, cold air slipping in under the edge of a quilt, the slow, practical work of making a person comfortable enough to keep going. And then the long middle hours when there is nothing to do but measure yourself against your own breathing. In a place like this, the porch is not a scenic feature. It is part of the treatment. It's also part of the psychology. Because when your bed is placed just outside the doorway, you are both inside and outside at the same time. You're not fully in the world, but you're not fully removed from it either. You can hear life in the corridor. You can feel weather on your skin. You can see the hill, the trees, the distance. And distance does something to the mind. It turns ordinary things into symbols. A passing cloud becomes a sign. A change in wind becomes a message. A quiet cough in the bed beside you becomes a reminder that the whole building is listening to bodies all day, every day. That's one reason Waverly Hills still feels loud even when it's empty. The building was trained for decades to pay attention to breath. And once a place is built to observe something, it never fully forgets how. Chapter 7. The Service Tunnel Below. Now we go beneath the building into a feature that has been rebranded by the internet, a tunnel. In the plain version of the story, it exists for a reason that isn't glamorous at all: heat and logistics. Accounts summarize it as a tunnel built to carry steam and supplies between a heating plant at the bottom of the hill and the main building above. It's also described as having a cable car system to move items up and down the passage. That makes sense in a world where winter exists and a hospital cannot pause because the hill is steep. But then the stories arrive. And here we have to handle the subject with discipline, because the same summary that describes the tunnel's practical purpose also says something else. That according to stories and anecdotes, the tunnel may have been used during a limited period to transport corpses down the hill,
out of sight of other patients. Notice the wording, stories and anecdotes, not a clean official statement, not a confirmed policy written on letterhead, just a claim that fits the emotional logic of the place. Keep death discreet, keep the living calm, keep the hospital functioning. And that logic is not supernatural, it's human. Hospitals do manage visibility. They do control what patients see. They do try to protect morale, especially in long-term care. Even without confirming every dramatic detail, we can understand why a story like this forms. A tunnel is private. It is out of view. It is physically separate from the bright porches where patients are told to breathe and hope. So it becomes a symbol. Above ground, the building performs medicine. Below ground, it performs concealment. And once that contrast exists, people will fill it with meaning for a century. If we step into the tunnel in our minds, we can describe it without feeding the spectacle. Concrete that holds cold, a slope that demands effort, air that changes as you move, cooler and denser, carrying the smell of damp stone and old dust. Sound that behaves differently underground, footsteps arriving before you're ready for them. Not ghosts, just physics and memory. Chapter 8. Counting the Dead Without Feeding the Myth. This is where most documentaries get tempted. This is where a narrator drops a single number and lets it echo. Tens of thousands, hundreds a month, bodies a day. But if we do that without care, we stop respecting the people who lived here long enough to die here. We also lose the real story, the one that doesn't need exaggeration. A safer approach exists. A Kentucky Historic Institutions project hosts a patient death index for Waverly Hills that explicitly states what it is: recorded patient deaths at Waverly Hills between 1911 and 1960, based on deaths that occurred at the hospital. It also states what it is not. It does not include patient data from the Geriatric Center era after TB treatment had stopped, and it's organized by date of death. That kind of clarity matters because it tells us two things at once. People really did die here, enough that a record is worth compiling carefully, year by year. And the record has limits, time limits, scope limits, and gaps that honest history should admit. So instead of chasing a viral headline, we picture what those years would have felt like. A hospital where the staff learns to keep their faces neutral, a ward where someone's bed is suddenly empty, a porch where the wind keeps moving even when a person doesn't. A building that has to carry two truths at the same time: compassion and exhaustion. And if we're going to talk about haunting at all, this is where it becomes more meaningful. Maybe the haunting isn't a figure in the hallway. Maybe it's the repetition of loss, the way a place absorbs patterns, the same routines, the same waiting, the same quiet endings, until the building itself feels like it remembers. Not because it's alive, because we are. Because we walk into spaces like this and we bring our own fear of dying with us, and we call that fear a ghost. Chapter 9. The Antibiotic Turning Point. The shift doesn't arrive with sirens. It arrives quietly, in laboratories and hospital charts, in doses measured small enough to fit inside a syringe.
In 1943, streptomycin is discovered, an antibiotic that becomes the first effective drug treatment for tuberculosis. It is not magic. Early antibiotic care brings its own complications, and medicine learns in real time, but it changes the direction of the century. Up on Waverly's porches, the change is not immediate. A hilltop hospital does not empty overnight just because a breakthrough exists somewhere else. A drug has to be produced, distributed, trusted, and administered, and patients have to arrive early enough in the course of illness for any new treatment to matter. Local historical summaries often note that while streptomycin is discovered in 1943, it is not until later in the decade, commonly cited as 1949, that it is available to patients at Waverly. So the 1940s become a hinge. The building still runs on routines built for rest and air, but the logic beneath those routines starts to change. Tuberculosis, increasingly, can be treated in places that are not isolated on ridges. Newer cases can be handled without a long exile from home. And once that becomes true, the hill begins to feel different. Not less tragic, just less crowded. There is a particular kind of loneliness that only arrives after the worst has passed. A ward that used to be full grows quieter. Porches that once held rows of beds begin to show gaps. The building, built like a machine for breath, starts running below capacity. It is the same wind as before, but now it moves through more empty space. And empty space is where myth likes to live. Chapter 10: The Last TB Days. Closures always look clean on paper. A date, a decision, a final day. But in places like this, the ending is usually a slow untying. Records and summaries consistently place the closure of Waverly Hills as a tuberculosis hospital in June 1961. By then, the Hill has already been living in the aftershock of antibiotics for years. Patient numbers decline, and the need for a massive county sanatorium weakens. In the broader state story, National Park Service materials describing Kentucky's TB hospitals note that as the patient base declined, facilities transferred patients to state-supported hospitals, and Waverly is described as transferring remaining patients to the state-supported Hazelwood Sanatorium by the end of the 1950s. So when the TB era ends here, it ends with logistics. Beds moved, rooms cleared, supplies packed, paperwork that tries to reduce human lives to lines of ink. And still, the building remains. Because buildings like this are stubborn. They don't disappear when their purpose expires. They sit on the ridge, watching the city below, holding decades of coughs and footsteps in their concrete. This is the moment in the story where people often reach for the paranormal. A hospital closes, a place goes quiet. Surely something must stay behind. But there is a grounded explanation for that feeling. The explanation is that for half a century, Waverly was built to hold what most people could not bear to see every day: prolonged illness, isolation, and death that arrived slowly.
When you remove the staff and the patients, you don't remove the emotional weight. You just remove the living witnesses. And in the silence, the building starts to feel like it is watching you back.
Chapter 11. Second Life, Woodhaven. A year can change a place. In 1961, the building stops being a tuberculosis hospital. In 1962, it reopens with a new mission, not to treat infection, but to house people whose lives have narrowed in other ways. Many summaries identify this second era as the Woodhaven Geriatric Center, beginning in 1962. And this is where the story becomes harder to romanticize. Tuberculosis is dramatic in the historical imagination: the White Plague, the hilltop cure, the porches, the fog. Elder care does not arrive with the same mythology. It arrives with exhaustion, with staffing demands, with the slow daily realities of feeding, bathing, lifting, monitoring, and protecting people who cannot protect themselves. In a building designed for fresh air treatment, the needs of a nursing home are different. The structure is large, the corridors are long. The isolation that once served public health now becomes a challenge for supervision and care. And this is the middle of the documentary where we have to widen the frame, because if the haunting story is only about ghosts, we miss the most important truth. The most disturbing chapter in this building's history may not require anything supernatural at all. The Hilltop Hospital doesn't just carry one kind of suffering. It carries whatever a society chooses to place out of sight. Chapter 12. A Shutdown with an Indictment. This is the chapter that doesn't need darkness added to it. Local histories and museum summaries place Woodhaven's shutdown in 1982 tied to reports of neglect and to a grand jury inspection or investigation that found serious problems in patient care and in conditions. Even when sources vary in how they describe the details, the shape of the truth remains steady. The building operated as a nursing home. Concerns rose about care and conditions. The state shut it down. That matters because it changes how we should speak about Waverly Hills. When people walk these corridors today, they often look for a ghost story that feels safe because it is entertainment. But the record points to something more sobering. A building can be haunted by policy, by understaffing, by what happens when the vulnerable are placed far from public view and the systems meant to protect them fail. This is also where myth versus reality takes on a different meaning. The myth says the building is scary because it is old. The reality says the building is scary because it tells a story we do not like to face. A society can build a grand institution on a hill, then struggle to care for the people inside it when the mission changes and attention moves elsewhere. So, when we ask what haunts a place like this, we have to include the possibility that what lingers is not a presence, it's a pattern, a repetition, a lesson that comes back whenever we stop paying attention. Chapter 13. Auctions, Plans, and the Historic Listing. After 1982, the building becomes something else. Not a hospital, not a nursing home, a question. And the first thing that happens to questions like this is that people try to answer them with a plan. Kentucky Historic Institutions summarizes the pivot in practical steps.
After Woodhaven is closed in 1982, the following year brings auctions and a purchase that opens the door to a prison conversion idea, a minimum security facility, and that idea collapses under public protest. This is the pattern that repeats for decades. A grand plan arrives, shiny and confident. The building resists it through cost, logistics, politics, neighbors, funding, and sheer physical decay. And then the plan leaves like breath in cold air. But something else happens in 1983 too, something that feels quieter but matters more over time. Waverly Hills Tuberculosis Sanatorium Historic Buildings is listed through the National Park Service's National Register system with a published date of July 12, 1983. That listing doesn't restore a broken window, it doesn't patch a roof, but it changes the language around the place. It says, in effect, this is not just leftover real estate, this is a public health artifact, an historic structure tied to health, medicine, and social history. And when a place is declared historic, it enters a strange half-life. It becomes protected in principle, but still vulnerable in reality, because historic doesn't mean safe, it means worth arguing over. So the building sits. For locals, it is visible from certain angles, a heavy silhouette above the neighborhood. For the city, it is both embarrassment and attraction. For developers, it is a puzzle with missing pieces, and for everyone else, it starts to become what abandoned institutions always become, a blank screen. People project onto it. They project fear. They project nostalgia. They project the romance of decay. They project the thrill of trespass. They project the fantasy that history is more interesting when it is damaged. The haunting story doesn't begin with ghosts, it begins with vacancy. Vacancy creates room, and room invites stories. Inside, the building begins to change in the absence of purpose. Paint flakes, water finds new paths, metal oxidizes. A place designed to regulate the environment for sick bodies becomes a place where the environment takes back control. And in that slow takeover, the building becomes more than a structure. It becomes a stage. Not because it wants to be, because we need it to be. We need abandoned places to mean something, or else they feel like waste. So we give them meaning. We say they're cursed. We say they're haunted. We say they never really closed. And sometimes that's just a way of avoiding the simpler truth. A society built institutions to hold suffering, then struggled to decide what to do with the buildings once the suffering changed shape. Up on the hill, it's still moving through the same openings, but now it's carrying a different kind of silence. Chapter 14. Saved by Tours and a Haunted House. By the time the Mattingleys arrive in 2001, the building is already famous in a specific way, not famous as a public health landmark, famous as a haunted place. Kentucky Historic Institutions describes the sale to Tina and Charlie Mattingly in 2001 and says they established the Waverly Hills Historical Society to raise funds and restore the interior through tours, an annual haunted house, and private events. A local news report years later captures the same idea from the owner's point of view. The haunted attraction is a fundraiser to preserve the building, and the long goal is saving a piece of history. And this is where the story becomes delicate. because it's easy to judge. It's easy to say turning a tuberculosis hospital into a destination is wrong. But it's also easy to ignore a truth we don't like. Restoration costs money, and abandoned landmarks rarely get saved by quiet respect alone. So the Hill learns a new trade. It becomes a place people pay to enter. It becomes a place where stories are exchanged for tickets, a place where the building's darkest associations become a funding stream. If you walk through the logic slowly, it is almost painfully modern. A public institution loses purpose. It decays. Private owners arrive. Preservation requires revenue. Revenue comes from what the public is willing to buy. And the public, more often than not, buys the version of history that feels like entertainment. So tours begin, seasonal haunted attractions begin, and alongside them, the steady, unglamorous work starts again. Windows, interiors, safety, repairs. Not a miracle, a long, expensive grind. Here's the strange part. The tourism doesn't erase the building's past. It doesn't even replace it. It layers a new use on top of the old one, like fresh paint over smoke-stained walls. And layered histories are confusing. A guide can speak about deaths and treatment, then pivot to a ghost anecdote, then pivot again to a fundraiser. It can feel disrespectful if handled poorly. It can also be the only reason the structure still exists to be studied at all. So we keep the verdict open, because both things can be true at once. Waverly Hills is a real historic institution rooted in public health and medical history. And Waverly Hills survives in the modern era partly because the public is drawn to its haunted reputation, which pays for preservation. The question becomes less about whether the building is haunted and more about what we are willing to do to keep history standing. Chapter 15. What haunts a place like this? Maybe what haunts Waverly Hills is not a spirit. Maybe it is a pattern of waiting. Tuberculosis care in that era often meant isolation and routine, long stretches of time where the cure was uncertain and the calendar was part of the treatment. The building was designed for that kind of life. Then antibiotics arrived, and the need for places like this began to collapse. Streptomycin is noted in the historical timeline as a turning point, discovered in 1943 and becoming available to Waverly patients by 1949. And by June 1961, the tuberculosis hospital chapter closed. After that, the waiting changed shape. A geriatric center opens in 1962. A different fragility fills the same halls. The closure in 1982 is tied in the record to a grand jury inspection that found patient abuse and degrading conditions. That is horror without ghosts. And then comes the long vacancy. A building that once held hundreds becomes an empty machine. People break windows, rain finds seams, paint peels. The hill keeps its fog. The city below moves on. So when modern haunting lore arrives, it lands on ground that is already heavy. A place like this does not need the supernatural to feel unsettled. It only needs memory. Here is the responsible way to speak about the dead, not as a viral number, not as a brag, not as a headline. There is a patient death index project based on recorded deaths at Waverly Hills between 1911 and 1960. organized by date of death and explicitly limited to people who died at the hospital during that period. It does not include the later geriatric center era. That kind of record does something haunting stories usually do not. It slows us down. It turns spectacle back into people. And once you see it that way, you can feel the real question underneath the ghost question. When a building witnesses that much suffering, and then witnesses neglect, and then witnesses reinvention, what exactly is left behind? Not only in the halls, in us, because we are the ones who decide what Waverly becomes now: a memorial, a classroom, a tourist attraction, a warning, or some uneasy mixture of all of them. Maybe the most honest verdict is the quiet one. Waverly Hills is not one story. It is a stack of stories, built in layers, each one using the same brick and the same hilltop air. And the final question is not whether something is still inside. It is whether we can tell the truth about what was.
Fog returns to the hillside the same way it always has. Soft, unhurried, almost polite. Waverly was built on a belief that altitude and clean air could buy life. Then medicine changed, and the building outlived its original purpose. Then care returned in another form and failed in a way that did not require myth. Then silence moved in, and eventually people came back, not to heal, but to look, to learn, to feel something in the dark, and to keep the structure standing. If there is a haunting here, it may be this: some places never stop being what they were made to be, even after the doors close. And maybe that is why the hill still draws attention, not because the past is chasing us, but because the past is asking not to be forgotten.